So treatment is very expensive. I want to do this for the rest of my life. Yeah.
実は歯科衛生士には無限の可能性があったんですけど、
そしてまた現場でも女性の活躍の場を広げていく、それを私たちドクターがアシストしていく。
Yeah, it's okay.
ジョバニ先生と一緒にお仕事をしている、歯科衛生士さんの、本当にリアルなお話を今日聞けるということで、僕も非常に楽しみにしているところでございます。スウェーデンではドクターのアシスト業務とそれから歯周治療、どのぐらいの割合でお仕事をされているのか、ぜひ教えていただきたいと思うんですけど。
Well, the difference between the dental hygienist and the dentist is that we work independently and we perform non-surgical treatment. Yes, and the dentists perform surgical treatment instead. Yes, we work independently, so it's very rare that we assist the dentist. So we work. So there is three different categories: dental assistants, dental hygienist, and the dentists. Yeah.
You do only periodontal treatment or something like that?
Yeah, we do a lot of tasks, taking x-rays and administering local anesthesia during non-surgical treatment, and yes. Many patients experience that the treatment is economically, it's very pricey here in Sweden. Yeah.
Price is high?
Yes,
Yeah.
exactly. It depends on. There is dental insurance, but not everyone has it.
Okay.
Yeah, up to 3,000 kronor. Yes, so that first bit you have to pay 100% by yourself, and then then the insurance starts to cover 15% or 50% of the procedure costs. And when you come up to 15,000, then they cover 80% of the costs. Yes. And the treatment has to be done within a year.
Oh.
Yes. Then it starts all over again. When you're under 18 years, yes, then you get the treatment for free.
Okay, free.
Yes,
If you're
yes.
over 65,
It's a
they
free?
will be also
No,
free.
no. Then you get an how do you say? You get 600 kronor a year that you can spend on treatment.
600.
Yes,
Only 600.
only 600.
Only 600.
Yes. So treatment is very expensive here in Sweden.
歯周病の治療を進める上で、患者さんとのコミュニケーションで心がけていることって何かありますでしょうか？
Well, I believe many patients have difficulties to how do you say? They don't have the knowledge about the disease. They have very low self-esteem because of periodontal disease. And well, I think communication is the most important part when treating the patient. When I'm communicating with patients, I try to have an open body language and to give clear information and to encourage the patients to ask questions so that they feel included in the treatment.
Maybe how long the explanation or discuss the time for patient?
Yeah, it depends on how much information that they know since before. There are some patients that have never been given any information about periodontal disease, and that takes a lot of time to explain all the parts and also to encourage patients to ask questions. So it can take up to an hour sometimes. And the next time when we see the patients, then we don't have to explain everything again.
患者さんがですね、長期的なケアを続けたくなるよう、何かどんな工夫とか、それからサポートをされているんでしょうか？
We try to include the patients in every decision if possible, and to offer information that is personalized, and we try to encourage every small step. Yes. And to be positive and to provide appointments that are regular. Yeah. It depends on how the oral habits are. Sometimes it's 1 month, sometimes it's 3 months or 6 months. Yeah. So it depends on how many practices.
1, 3, 6.
Yes, 1, 3, 6 usually. I think many patients understand the importance of preventative care, but due to economical difficulties and the lack of pain and immediate issues, many decline appointments.
Okay.
But most of the people are motivated and they come to their appointments, but some decline.
日本の衛生士さんの場合はですね、結婚とか出産を機に離職してしまうことが多いと私も聞いているんですけども、スウェーデンでは定年退職まで働き続ける方が多いと聞いていますと。国やクリニックからのサポート、そういうものをぜひあったら教えていただきたいなと思います。
Most clinics offer annual healthcare support. And for that money, you can purchase gym cards or memberships in physiotherapy and such massage. Also, most clinics offer 1 week or 1 hour during a week for health exercise, such as walking together or doing yoga or something like that together. Yeah, and in my case, I have chosen to only work 4 out of 5 days a week. In order to balance personal and work life. And many dental hygienists in Sweden choose to actually work part-time since it's physically demanding work.
So it's not, you don't need to quit when you're married or something, like give a birth or
No,
something.
I want to do this for the rest of my life. Yeah.
Last question.
Yes.
日本の衛生士さんへぜひメッセージがあればお願いしたいなと思います。
Well, I think keep working and keep helping people to achieve healthier teeth and healthier lives. Yes, that's the message I want to share.